Right, there's President Biden speaking at NIH right now as he is rolling out his plan for what's going to happen in the winter months here. And of course, we had our first Omicron case in the United States yesterday up in Northern California. Second one now confirmed in Minnesota this morning. And let's find out locally what's going on when it comes to the pandemic here at home. And joining us for our weekly visit is Dr. Henning Ansorg from Santa Barbara County Public Health. Dr. Ansorg, hi there. Good to see you again, joining us via Zoom. So let's start with Omicron. What do we know, and maybe more importantly, what don't we know about this new variant?
Yes, Joe. Omicron is really a new kid on the block, so to speak. It is very different in its in its genetic makeup compared to the Delta variant or to the previous Alpha variant. And just because of the sheer difference in mutations and the number of mutations, it has us, on alert to because we will need another 2 weeks to find out how well our vaccines protect us against this particular variant. And go ahead.
What are we seeing in the cases that have popped up? We kind of hear them in the news. People have mild symptoms. What makes doctors and scientists think that it may be more transmissible or may be more dangerous? Do we even know yet?
No, we honestly do not know at this point. It's too early to know. The virus really has to be tested for like 2 to 3 weeks in the labs to make a really definitive, recommendation and assessment of how sick it makes people. Yes, you are right. Anecdotally, it sounds like from South Africa that those people who got the virus did not get horribly sick. They did not end up in the hospital. But we need to understand that if somebody requires hospitalization, that's usually about 10 days to 2 weeks after they got infected. So it's a little bit early because those cases were only just a week ago. So it's a little bit too early to know. But we are really taking this very cautiously and seriously. And so time will show. Every day we get some new information.
How would we know if we have a Omicron case? How does that work when you guys take a test from someone? Where does it get shipped to? And then how do you find out if, this is Omicron or not?
Yeah, exactly. What has to be done to differentiate the different variants is we have to look at their genetic makeup. We call that genome sequencing. And there are specialty labs. We are fortunate here in Santa Barbara. We have UCSB with a very powerful virology department and virology lab. It also works for the state, but we have, because of locally, we can get samples tested there on short notice, which is a real advantage for us locally.
Yeah, correct?
No, we have not.
Okay.
We have not.
Where do we stand case count wise? There's a lot of holiday events coming up, people going out to tree lighting ceremonies and families are getting together. It's a good time of year for that, and we were looking forward to a more normal time. Where are we case wise?
Yes. The case numbers look a little bit all over the place right now. And one of the reasons for that is that because of the long holiday weekend, there's some backlog of results. People didn't go testing as much because they were visiting with family. And if somebody got sick while traveling, we won't know yet. That takes about 10 days to 2 weeks for us to really find out. So by next week, we should know how much Thanksgiving did impact our case rate locally.
And then with Omicron circulating, and obviously Delta is still, the most prevalent one that we have when it comes to variants, what are you encouraging people to do?
Exactly. That is exactly the right message to give. Is we are still dealing with Delta. 100% of our cases right now are Delta. We do know the vaccines work. So please get vaccinated if you haven't gotten vaccinated yet. And please get a booster if your second shot is 6 months ago or even longer, and 2 months ago if it was the Johnson & Johnson, just to get your immune system really mobilized for any winter surge.
With the holiday season coming up, do you suggest people go get a test before they get together?
I think that's a really good idea. I think the more we test, the better. There are over-the-counter tests that you can do yourself. We have testing sites all through the county that have availability, and they are free. So I would really encourage people to get tested more than usual, especially during this time, because last thing you need is to spread it, to your family and loved ones.
Onsorg from Santa Barbara County Public Health, thanks for joining us, providing an update with Omicron, the new variant that we've seen. Just a couple of cases so far in the country, but we know it's here. We're just waiting to find it. Thank you.